How do we cope with depression? Coping with depression is a matter of staying on track with your management plan, whether that means taking your medication regularly, going to psychological therapy, or a combination of both. There's also a range of things you can do for yourself, which can help you prevent further episodes of depression. The general principles are keeping well and recognizing early warning signs of illness, two important aspects of overcoming depression. Learning to identify triggers is important too. Perhaps you get depressed following a long period of too little sleep, or from drinking too much alcohol. You may find that working very long hours or spending too little time with your loved ones has a negative effect on your mood. Once you've identified your own triggers, you can learn to avoid them and prevent further episodes of depression. The first of these subtypes is non-melancholic depression. Keeping well in non-melancholic depression is also a matter of recognizing and learning better ways to deal with stress. For example, if your non-melancholic depression is caused by high levels of anxiety, unhelpful thinking and poor problem-solving skills, it's likely you'll benefit from working on those issues with a mental health professional. You could learn techniques to lower your anxiety, like meditation or mindfulness, which involves making simple shifts in your awareness of thoughts, feelings and bodily sensations. You can learn to challenge your unhelpful thinking through cognitive behaviour therapy, and to develop strategies for working through problems so they don't build up over time. Working with a therapist can also help you learn new ways to handle stress that protect you from becoming depressed when those stresses occur in the future. In non-melancholic depression, keeping well and preventing relapse includes recognising possible sources of stress, sticking to your management plan, and continuing to practice the skills learned in therapy. Other ways to remain well include regular exercise, challenging negative thoughts when they occur, breaking down difficult tasks into small steps, and talking to someone about how you are emotionally. Certain personality styles can make us more likely to get non-melancholic depression. Understanding how your personality works with particular kinds of stress can help you tailor your management plan to your individual needs. As each of us has different warning signs about relapse, noticing these signs is important to keeping well. For one person, an early warning sign might be difficulty in getting to sleep at night because of worry. For another person, it might be muscle tension, headaches and loss of appetite. Becoming familiar with your early warning signs and taking action when they occur is a vital part of preventing further episodes of depression. The second and third subtypes are melancholic and psychotic depression. Both of these usually require medication as a first step to recovery. Then, counselling and psychological strategies can help with relationship or work-related issues as needed. Keeping well and preventing relapse in melancholic and psychotic depression usually involves staying on your medication until your general practitioner or psychiatrist advises you to stop. While there are different views about medication, research has consistently shown that reducing or stopping medication too quickly can cause a relapse in these two types of depression. Other keeping well strategies for melancholic and psychotic depressions include making extra appointments with your psychiatrist or psychologist, or joining a support group. Now, how do we stay well? Let's talk now about different wellness strategies or ways of keeping well. Like treatment approaches, wellness strategies need to be tailored to each person's needs. One person might enjoy regular exercise as a strategy to prevent stresses from building up. Someone else might find a hobby, meditation, or reading more helpful to them. In general, keeping well means taking care of your physical health by making sure that your diet, activity level, and sleep are right for you. It can also be helpful to engage in activities you enjoy and that give you a sense of achievement, like making something with your hands or learning a new skill or a new language, for example. So to summarise what we've covered, there are some key steps you can take to recover from depression and keep well. Get professional help. Create a suitable management plan with your health professional. Stick to the plan and work through any difficulties with your health professional. Learn to recognise triggers that make you depressed and identify your own early warning signs of depression. And use self-help strategies and make changes to your lifestyle to keep well.